Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive. And welcome to Smooth Health on the Drive, brought to you by Evercare Hospital, Lekki. Today we're talking about brain tumors, symptoms, causes and treatments. And our guide for this conversation is Dr. Edwin Jolayemi. Dr. Jolayemi is a neurosurgeon with experience in a diverse range of brain and spine pathologies. He's a graduate of the College of Medicine from the University of Lagos. He had his neurosurgical training at the Lagos University Teaching Hospital with additional neurosurgical exposure at Groote Schuur Hospital, Cape Town in South Africa. His competence spans neurotrauma, neuro-oncology, pediatric neurosurgery, pituitary surgery, neurovascular and spine surgeries. He's a fellow of the West African College of Surgeons and the National Postgraduate Medical College of Nigeria. He's an active member of both local and international neurosurgical professional bodies. Welcome, Dr. Edward.
Thank you very much for having me.
All right. Yeah. So let's get straight into the conversation. Okay. What is a brain tumor?
Yeah, thank you very much. I will try as much as possible to avoid using medical terminologies.
Thank you.
So yeah, brain tumors. So we have the brain and you have tumors. So brain, we all know what the brain is. So the brain is the structure that controls virtually all parts of the body. Then we have what we call tumors. So tumors are abnormal growths that can be anywhere in the body. So when you say a brain tumor, it means we have abnormal growth within the brain. Now, to give us a better perspective, I'll just give you a little of the anatomical description of how the brain is actually structured. Now, the brain is located in the skull, and it's actually there with the skull acting as a protective structure to prevent it from damage or injury. Now, the skull itself is rigid, and naturally it won't expand to allow any other additional thing growing within the skull. The brain itself is covered by a membrane we call the meninges. Now, brain tumors, they can arise primarily from the brain or from those coverings, sometimes even from the skull compressing on the brain. Now, there's another group of tumors that can occur in the brain. They're actually tumors we call the secondary tumors. They don't arise primarily from the brain, but they come from other locations. Like, for example, someone has a breast cancer that has spread to the brain. So, yeah, patients can have that, what we call the metastatic brain tumor. Now, for these brain tumors also, you can also classify them as whether they are benign, that means they are non-cancerous. The kind of thing you say, maybe the good brain tumors, and then you have the malignant ones, the cancerous ones. Yeah, the bad one.
Okay.
So the bad ones, that's the malignant ones, they tend to grow very fast. The manifestation is rapid, whereas the benign ones are slow growing, and sometimes they attain great or huge sizes before they are picked up. So yeah, that's a summary of what brain tumors are all about.
Okay, so what are the possible causes and the risk factors as well of these tumors in the brain?
Yeah, really, the causes of many tumors in the world is really not known. There are only few tumors for which we know the cause. Same thing for brain tumors. Actually, the actual cause is unknown. But what we have is what we call risk factors. So the risk factors for brain tumors are actually few also, because some of the tumors are not really understood. But the strongest risk factors are family history or genetics. So you have some members of the family who had a brain tumor. It increases the likelihood. Doesn't mean that the person is going to, everybody in the family is going to have a brain tumor.
Right.
But the chances of having a brain tumor in another individual is higher than the general population. Same thing with genetics. Now, cigarette smoking. Cigarette smoking too has been shown to increase the chances of virtually almost any malignancy in the human race. Then you have exposure to radiation. Actually, it's ionizing radiation, not all radiation. Sometimes patients have radiation therapy for other diseases, so that can increase the risk that they will have such malignancies. There are other risk factors that haven't been clearly defined. So most times we don't really talk much about them. Research is still ongoing about these risk factors. Yeah.
So when people hear that they have brain tumors, for most people it always comes as a bit of a shock. So are there any early warning symptoms or signs that could indicate that a person has a tumor?
Thank you very much for that question. Yes, the part of the problem, like I mentioned earlier on, is the fact that the skull is rigid and any other thing growing within the brain would not have enough space to grow, rather to compromise on the brain. So, and the brain itself, just to say, also is mapped. It has its own mapping. There's parts of the brain that control behavior, parts that control vision, parts that control hearing, parts that control how we move different parts of the body. Now, some of the commonest symptoms that you will see in patients that have brain tumors are persistent headache. That's one of the commonest symptoms because something is growing in the head, of course. There's no space, the pressure is high, and typically this headache is oftentimes more in the morning. And sometimes you have some patients that have vomiting alongside it, and sometimes when they vomit, the headache is relieved a bit. So that's one of the symptoms. Another symptom that they could present with is seizures. So if an adult comes to me, for example, and says for the first time he's having a seizure, the first thing I'll be thinking of is, does he have something growing in the head?
Right.
Well, that's one of the commonest symptoms. Then you have some people that will just say, okay, for example, the way this person used to behave before is different. It's aggressive, and then they'll term it to be something else. But it could actually be a brain tumor that is growing.
Like a change in behavior.
Yeah, a change in behavior. Sometimes you have weakness of body parts, progressive loss of vision. For children too, because they could have brain tumor, sometimes you just notice that the way they walk is now unsteady. They have tendency to fall to a particular side. A child that could be writing before is now not able to write because he lacks the coordination to write. And you have a host of symptoms. So because the brain virtually controls the whole part of the body, almost any symptom is possible. So but most times when we pick them, especially if you go to a facility where you have neurospecialists, it's easy to fish out these symptoms from the patients and look out for other clinical signs, and then be able to give a diagnosis that probably this patient has a brain tumor.
Okay, and you spoke about headaches, particularly early in the morning. What is the significance of the timing?
Yeah, so when we sleep, usually when we stand, blood drains from the brain. It's easy for venous, what we call venous drainage. Blood goes to the brain, blood comes out of the brain. When you lie flat, gravity doesn't help that drainage. So the tendency is when you lie down, the rate at which natural gravity helps to drain the blood from the brain is less. So you now have additional blood in the brain, the tumor swells, and then it increases a bit in size. Then they have that headache. Then they notice over the course of the day when they are walking around, because you now have more drainage of blood from the brain, it reduces in size. Just like some people, they'll say their legs are swollen when they sit down in a place.
Right.
And when they lift it up, it starts going down. So similar thing happens.
All right.
Yep.
Well, we're speaking with Dr. Edward. Dr. Edward is a neurosurgeon, and we're talking about brain tumors, the symptoms, causes, and treatments. If you have any comments or any questions for the doctor, you can, of course, reach out to us. The WhatsApp number is 0809 444 0981. Dr. Edward, does this growth or do the tumors actually cause any pain?
Funny enough, the brain doesn't experience pain.
Really?
And that's why you hear of awake surgeries, awake brain surgeries. So if it's possible to open the head and you touch the brain, the patient, nobody's going to feel pain. But now, the pain that is felt from these tumors is because of the tumor itself irritating structures around the brain and naturally feel pain. Like maybe it's around the nerve or from the pressure of the tumor causing headache and the likes. But naturally, the brain doesn't feel pain. So the tumor per se is not causing pain. It's the effect of the growth in that tight space that is giving the patient those symptoms.
Okay, so I'm curious about this. A lot of people spend, of course, massive amounts of time talking on the phone, on their devices and things like that. And I don't know if I'd call it a misconception, but people do believe that mobile phones and the usage could cause brain tumors. Is this fact or fiction?
Well, it's both facts and fiction. I don't know. Now, you have a lot of theories about the use of phones. You know, it emits radio frequency waves. A lot of research has gone into it, but there's no convincing data to suggest that with what we see, there's a link between the occurrence of brain tumors and the use of phones. Although some studies have also said chronic use of phones, especially for calls over a course of 10 years, seems to increase the possibility that an individual may be predisposed compared to others to have brain tumors, but nothing hard and fast has been found. So maybe in a couple of years, maybe in 50 years' time, with the chronic accumulation of the use of phones, we could be seeing a different picture. But for now, there's nothing to hold on to. And secondly, radio frequency waves are actually not ionizing radiation. If you can remember, I said one of the risk factors is exposure to ionizing radiation. So radio frequency waves, they are not ionizing radiation. So really, we don't expect them, at least for now with the data we have, to cause brain tumors. But it doesn't mean that we should not limit the use of these devices too.
Okay.
Yeah.
Now, earlier you spoke about, children possibly being uncoordinated and not being able to write as a possible symptom of a brain tumor. Does this mean that children, adults, anyone can be affected?
Yes, brain tumor can occur in any age group. I've seen brain tumors in a newborn. I've seen in 90-year-old.
Wow.
So there's no particular age group. So for the children, their own brain tumors, they tend to occur in a particular location that the rapidity at which they present is faster. So it's as a part of the brain we call the posterior fossa. It's actually a tight space. So most of their tumors occur there, or in a part of the brain we call the brainstem. And oftentimes when it occurs in these areas, what it picks is their gait, their ability to coordinate themselves, and for the very bad ones, if it's in the brainstem, it picks a whole lot of other areas of function of the body, like difficulty with swallowing, vision, and the likes. And very rarely, also sometimes they present early, they present in a younger age group, you can actually start having the head size getting bigger, because in children their skull bones are not yet fused, so it gives you room for the head to increase in size. So you have a whole lot of possibilities by which they could present to the hospital.
Right. Doctor, I want to know about this. How long can a person actually live or survive for if they have a brain tumor?
It depends. Like some brain tumors, actually, I forgot to mention, are actually asymptomatic. So there are some people walking around the streets, they have brain tumors, but they don't know. And the reason is that probably it's small. It's probably not located in an area of the brain that has significant function for them to see. So most times, by the time people are presenting, it's huge for you to see it or to see symptoms and signs that yes, there's something growing in the head. So it's not a hard and fast rule. So you have people with brain tumors, we just watch them over the years. We say, okay, it's looking small now. Let's see how it will be in another year. Has it increased in size? Has it not increased in size? So we follow them up. If it's staying the same size or it's not increasing so fast, we can monitor it. If it's not causing any significant neurologic deficit, and at the point it grows big enough to maybe cause a symptom, we can go after it. But some patients will say, okay, they don't even want it there at all, so we can go after it and chase after it. Also, there are some tumors that by the time they come, they are so huge or they are located in very delicate parts of the brain, and you know that yes, this one, there's no possibility of you getting the whole tumor out. So sometimes you just go and debulk, or you stage the surgery. You can come today, take part of the brain tumor, allow the patient to acclimatize and to adjust, get better, and then you plan the second surgery. And there are also other adjuvant therapies that can be used, like the radiotherapy. You can use it to burn tumors, residual tumors in some delicate parts of the brain. So those are some of the things that could be done for this tumor.
All right, we're speaking with Dr. Edwin Jolayemi, a neurosurgeon from Evercare Hospital, Lekki. We'll take a quick break, and when we return, the conversation will continue. And if you've got any questions, any comments for the doctor, don't forget, you can send them to us via WhatsApp 0809 444 0981.
We are your number one adult contemporary radio station.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
98.1. Luxury music.
Smooth 98.1, love music, love life. This is Smooth Health, brought to you by Evercare Hospital, Lekki. We're talking about tumors and everything with regards to treatment, symptoms, and causes. Our special guest is Dr. Edwin Jolayemi, a neurosurgeon from Evercare Hospital, Lekki. All right, Dr. Edward. So let's get back to the conversation. When is the best time, ideally, for a person to speak to a doctor if they suspect that they may have a tumor?
Yeah, once you suspect or you think that you have a brain tumor, the best thing to do is to present immediately. What we find in our own setting is people delay those symptoms, and by the time they present, the tumor is so huge. So that puts a lot of risk to the patient, because then it means longer surgery duration, likely the tumor has infiltrated other important key areas of the brain. And then the likelihood of you getting everything out may be less than if you had come when it was smaller, maybe the size of a ping pong ball. So
that seems large for the brain.
Yes, large. So depending on where it is, even some as small as a bean seed in some parts of the brain can actually produce significant symptoms. Right. That's how important the brain is, how sensitive it is. So the important thing is, once you see any of these signs and symptoms, persistent headaches for which you have no explanation, with vomiting, loss of function of body parts, it's not everything that you have weakness of one side of the body that you say a stroke, which is a common thing that happens with a stroke. You have stroke. It could be a tumor that is growing. There's another set of tumors we call the pituitary tumors. Even some patients, you have them, ladies, you see them, they say they have milk coming out from their breasts. It could be from what we call the pituitary gland producing the hormone that's releasing excess amount of what we call prolactin to stimulate the breast, even though she's not lactating, she's not supposed to be lactating, and she doesn't have a baby. So important thing is, once you think that you have any of these signs or symptoms you suspect, the important thing is you give it a check and then present to a facility where neurosurgical services are present. And if you check, if you pick a brain tumor, then we'll tell you what next to do. If you don't pick anything, at least you've checked, and then you're sure.
Right, okay. And let's talk about treatments and cures of tumors, particularly brain tumors, of course. So, can brain tumors be cured?
Yes, brain tumors can be cured. Like I said at the beginning, you have what we call the benign brain tumors, and we have the malignant one. So there are some brain tumors, they present early, they are benign, they haven't grown significantly to involve other structures. You can actually totally excise them, and the patient is cured. However, you have some that are virtually extensive. You know that, yes, even during the surgery, you know that in your mind, you know that you are leaving some behind. So the chances are that it's going to come back. So for those, if it's not significant enough, you could use other modalities to treat them. That's like radiotherapy. There are some that maybe hormonal therapy could work for. And then you have the malignancies. The malignancies in the brain, that's the cancerous ones, are actually very, very stubborn. Like, remember, even John McCain of the United States died from a brain cancer of the brain. The current president, his son, same thing. So those ones, you go today, you take it out, in another 3 months it's back. So those ones, you keep having to go back to take them until the patient succumbs to it. So really,
until the patient succumbs to it.
Yeah, for gliomas, they're actually very horrible tumors. In short, if you want to pray for something bad to happen to your enemy, don't pray for your glioma.
So that form cannot be completely treated.
It would always come back. Most times, depending on the grade, but the highest grades, that's the grade 4, they are very stubborn tumors.
Wow.
Yeah.
All right, so are there any things that people can do to sort of prevent the likelihood of developing a brain tumor?
That's a very technical question, because even if I could do something to prevent myself from having a brain tumor, I think I will. So like we said, we don't really know the cause of the brain tumors. But if you think you have a family history, for example, then watch out for these signs and symptoms. If you see any of them, don't hesitate to go to a medical facility and check. Cigarette smoking, you can decide not to. It's a modifiable risk factor, which we can decide to. So we advocate actually even for other health conditions to disease or stay away from cigarette smoking. Apart from that, there's really nothing one can really say, okay, don't do this, so you won't have a brain tumor.
Wow. Yeah. All right. So, Dr. Edward, I want to ask, what are the procedures and tests as well that your hospital, Evercare, would actually take in the process of testing and diagnosing the different types and grades of these tumors?
Brain tumors. Yeah, Evercare is a private multi-specialist tertiary healthcare facility, and you have a lot of specialists there. So we have the full complement of specialists to handle patients with brain tumors. Usually when we operate on brain tumors, we need a multidisciplinary team coming together, the intensivists, you have the anesthetist, the neurosurgeon himself. If patient has other comorbidities, we invite them. So in Evercare, we have, first of all, the investigative modalities for diagnosing brain tumors, like the MRI machine, CT scan, which we use for these patients. So patient goes under the scan, we pick whether the patient has a tumor. If the patient has a tumor, patient can be planned for surgery. And also in Evercare, we have the facilities for neurosurgical management of brain tumors. We've done a couple of brain tumor surgeries, and the outcomes have been fantastic. And with the full complement of all the ancillary staff, outcomes are oftentimes good. If and only if patient presents early. Even for the ones that present late, there are ways to manage them. It might mean staging the surgeries and then getting them out in bits. And then even in the post-operative period, if there are residual tumors, that you have the radiotherapists that could follow up these patients and decide, okay, do we give radiotherapy now? Do we wait? So you have the full complement of the multi-specialty team. And we are fully well equipped to handle brain tumors.
So if a person, it's confirmed that a person has these brain tumors, apart from surgery or these radiation therapies, can medication be used?
Yeah. The thing about the brain is in its own box. We call it the cranium, in the skull. In that skull also, it's covered by a membrane. And the way it's structured is that there are very few things that can actually penetrate to the brain. So things like tumors, alcohol, somebody's taking alcohol, that's why somebody drinks alcohol, is high, is tipsy. Many of the medications we take actually they're not able to cross the brain. That's what we call the blood-brain barrier. Yeah, so usually what we call chemotherapy, giving injections and stuff, saying you are using to treat a brain tumor, the efficacy is not so significant. In some cases, we try to inject those chemotherapeutic agents. There are some of them injected through the spine and hope it to circulate in the fluid of the brain. But by the time you are doing that, it's usually for advanced and sometimes the malignant, most times the malignant brain tumors. So it's use of medications, that's chemotherapy, is not really a major treatment modality. However, for the pituitary tumors, like the prolactinomas, for example, there are some medications that can be used. Usually we operate them through the nose, but for some patients, they say they don't want surgery, so they could use medications to try and see if it will shrink the tumor. And that's because that medication targets that hormone. So it reduces the size, maybe over a couple of months to maybe a year or two, it will shrink the size of the tumor. Yeah, so most times you hear patients say, okay, is there not something you can take to melt it? What I usually tell them is it's not going to happen. So if something is growing there, you go take it out.
All right, I've got a few messages coming through. This says, good evening all, this is Rejoice from Lagos. Thumbs up to Dr. Jolayemi, he's so explanatory. Going by his explanation, I think we can prevent brain tumors by avoiding the modifiable risk factors that predispose to the secondary causes of the tumor.
Yeah, that's very correct.
Okay, and this says, please tell us how they ensure accuracy during brain surgeries to prevent complications.
Yes, thank you very much for that question. Unlike other specialties where you can actually touch some parts of the organs and get away with it, the brain is so delicate that every part you touch is actually significant. So while it's operating on these patients, it starts from even the preoperative period, looking at the images, seeing where a particular vessel is, how you're going to avoid it, planning the surgical trajectory, and then at surgery, we don't use our naked eyes to operate. We use the microscope. We try to blow everything up so whatever looks tiny is larger. And then operating on the microscope, we try as much as possible to tease out that abnormal growth, which is the brain tumor, from the normal surrounding brain. And most times when these tumors are invading important structures, you try to tease them out and they don't tend to budge. You just leave it behind because you don't want to compromise function of the patient for trying to take out this tumor.
Right.
You understand? There are also higher end technology that's used in some parts of the country. Plans are underway to get it down to Nigeria to see how to. Sometimes you're going after a tumor, you can give an injection that will color the tumor a different color, and then you just go after that abnormal color. There are also facilities whereby you can connect modalities to the patient. Somebody is monitoring and say, okay, yeah, you are going there somewhere, step back. So somebody is guiding the surgeon just to ensure that as much as possible you don't injure the normal brain. So patient comes out deficit free. So usually it's a matter of experience and team work, And for neurosurgery, it's actually a very, very important part of the management of these patients.
Right, doctors, I want to ask, how does the follow-up care after a brain tumor treatments go, particularly at Evercare?
Yeah, so the follow-up care starts from immediately after the surgery. Patient goes to the intensive care unit for a short duration, gets to the ward. On the average, maybe 5 days to a week, depending on how the patient presents. Patient goes home. So we expect that maybe after 3 months, we do a repeat brain scan to see how the extent to which this tumor has been excised. So if there's no tumor, we say, okay, that's fine. We can say come back in a year, repeat the scan. We do it in a year, there's no tumor. Come back another year, do another brain scan, no tumor. Come back in 2 years, no tumor. Come back in 5 years, no tumor. If there's no tumor, then we assume patient is cured. If you come back and we say, okay, there's residual tumor, 2 options. Okay, let's plan a second surgery. And that depends on how much is left and if it is causing significant compression in the brain. So we could go chase after it, or if it's not significant enough, we could say, okay, let's watch on serial scans also to see if it's going to increase in size, or if it's the type that is amenable, as the malignant ones, to other forms of therapy like the radiotherapy or the hormonal therapy, then we deploy that. So that's how. So we don't really send them away. We want to watch them for a while and then see how things go. For those that might have presented before, maybe they've already have the paralysis before they even started the surgery, it's not automatic that you do the surgery and maybe vision will come back. Usually once vision is gone, it's gone. The patient is blind. There's no surgeon that's going to bring that back.
So some brain tumors could actually cause blindness.
Many of them do, because the nerve that goes to the eye is actually inside the head. By the time the whole pressure is transmitted to that nerve, it actually kills the nerves, and gradually the person is losing vision. At the point whereby they can no longer see light, the patient is said to be blind. And we usually tell them upfront that we don't think we can preserve vision. So what we are trying to do here is to preserve life, because if we leave the tumor to grow big enough to compress on the part that maintains consciousness, and then that will cause death in itself.
Wow.
Yeah.
This doesn't seem like a very happy job.
Sometimes.
All right. So, doctor, can you tell us how our listeners can contact you at Evercare Hospital?
Yeah, thank you very much. Evercare Hospital is located at number 1 Admiralty Way, Bisola Durosimi Etsy Drive in Lekki Phase 1. Our website is www.evercare.ng. And you can reach us on 081-3985-0710. The phone lines are open 24/7. And our email address is info@evercare.ng.
All right, we have a few more questions coming through, but we're out of time. But I think we can take just one. I can't see a name here, but it says, can recurrent migraines be a symptom of brain tumors?
So migraine is a different pathology on its own. It tends to be vascular in nature, so it's the brain's response. The vessels, I said the brain doesn't feel pain, but the vessels in the brain, they feel pain. So sometimes they have this stretch from a slightly excess amount of blood, and they have this persistent headache. So in those kind of patients, you do a scan, you're not going to see a tumor. So what they have is they have headaches from another cause, medical cause, and that's when we send them to the neurologist. The neurosurgeon, like myself, we treat brain disorders using surgery. Okay. Whereas the neurologist treats same brain pathologies using medications. So in those kind of scenarios, somebody is having headache, you manage, you do a scan, you don't see a tumor, then there's a headache clinic, the neurologist manages, and they can classify the headache. There are different types of headache: cluster headache, migraine headache, tension headaches, and the like. So yeah, so migraine is not from brain tumors.
Okay, well, thank you so much, Dr. Edwin Jolayemi, for speaking with us. I felt like I had a crash course in neuromedicine.
Thanks for having me. And thanks, everyone.
Thank you. And that's it for Smooth Health on the Drive. Today, Smooth Health on the Drive comes every Thursday from 5:15 p.m. right here on Smooth 98.1. I'm Zibby. Do stay tuned. There's a lot more to come on the Smooth Drive.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
Hey, what's going on, people? This is Uzi Kwendu. You are now listening to the Smooth Drive.